Now, this war needs a wartime plan to fight it. Solidarity is essential. The words of the United Nations Secretary General about the COVID-19 pandemic sweeping the globe. Antonio Guterres has also called for a global ceasefire in conflict zones and has launched a $2 billion coordinated global humanitarian response plan for vulnerable countries. The UN chief joins us now live from UN headquarters in New York. A very good evening to you, Mr. Secretary General, and welcome from a lockdown South Africa. Can we start there? South Africa just announcing our first death. There's a second suspected death from COVID-19. We're in a 21-day lockdown. The sense, as it is everywhere, is that things will just get worse. Any message, any words of wisdom to a country like ours in this situation?
Well, a message of solidarity. I'm also in New York, where I cannot move. My family is in Lisbon. We have a situation that is indeed very similar, but there is a fundamental difference. We believe that there must be massive support from the developed countries to the developing world at the present moment. Support in relation to all the medical aspects to respond to the COVID-19, but also economic and financial support to address the economic and social consequences of this pandemic. This is not a financial crisis, it's a human crisis. And what it is necessary is to support people that are losing their jobs, that are losing their salaries, businesses, especially small businesses that can no longer. And this is being done in the developed countries because they have the funds to do so. But we need to mobilize, and according to our estimate, the whole of the developing world would require some $3 trillion of support through the IMF, through the World Bank, international financial institutions, bilateral support in different ways, swaps among central banks, guaranteeing the liquidity of the financial systems in countries like South Africa and many others, and at the same time guaranteeing that those countries can also apply the social and economic measures that their peoples require in this very dramatic situation. This is a moment in which the role of the UN is to tell the world that solidarity at the present moment means massive support of the developed countries to the developing world.
Yeah, you have appealed for that $2 billion, I think, in more direct support for countries, for humanitarian relief, for countries like ourselves, for countries in Africa. But does $2 billion go far enough?
Now, these $2 billion are only to the extremely vulnerable situations. They are beyond what I just mentioned. They are to the most vulnerable situations to allow for the UN agencies to be able to provide support to refugees in refugee camps, to people internally displaced, to those situations where we already have humanitarian operations because of conflict. And there it is absolutely essential that the response to COVID-19 is not made taking funds out of other forms of support that are being done in shelter, in food, in medicine. And so we have appealed for these $2 billion to enhance the UN agencies, the Red Cross, Red Crescent movement, the NGO, in action in support to member states relating to those very vulnerable situations. Yeah. But what I mentioned before was much more than that, is the kind of package that the developing countries need to be able to provide to their economies liquidity in the financial system, but support to workers that lose their jobs, to people that depend on the informal economy and can no longer survive, to businesses that need to keep their employment at the same time that cannot sell. And all these, the demonstration is made here in the United States. It requires about 10% of GDP. That's what the American Senate approved for the US. What you are saying is that these kind of measures can only be for the developed countries. The developed world must mobilize also these funds to allow developing countries to provide to their citizens, to their workers, to their unemployed, to their businesses, to their small companies, the same kind of support that is happening now in Europe and in the United States, for instance.
Are the developed countries showing signs that they are listening to you, that they are hearing this call?
We believe that now the IMF has a lending capacity about already $1 trillion. We have been strongly advocating together with the IMF for the emission of the so-called special drawing rights, which is the modern way to print money. We have been pushing for increased resources for the World Bank and for other the development banks like the African Development Bank. We believe that central banks should do swaps for the central banks of the developed world to be able to support the liquidity of central banks in the developing world. And all this is happening, but the point is that it needs to gain scale, and it needs to be much more quick and much less bureaucratic, and not with conditions that sometimes are impossible to meet, in order to provide the liquidity and the support that the countries in the South today absolutely need.
What you're saying is that the coordination that you want is just not there. You've also called on the G20 countries to work with the World Health Organization, but it seems like it's not there. Why does the world appear to be so ill-equipped to deal with this moment, Mr. Secretary General?
It is true, for the moment we do not have a very articulated response to the COVID-19 with a strong coordination among countries. We have the World Health Organization that has very clear guidelines, but many countries are not following them. What we would need, and we proposed it to the G20, was a mechanism of coordination guided by the World Health Organization, but in which the strategies in each country, from testing, from tracing, from quarantines, from lockdowns, to all these to be done in an articulated way in order to defeat the virus, to suppress the virus. If each country goes by its own way, unfortunately we will probably not have the kind of coordination that is necessary to defeat such a treacherous, such this virus is difficult to suppress because it transmits very easily and it moves very, very easily, and so it's absolutely essential to have a much more coordinated action among member states.
Yeah.
And yesterday I think there were some steps in the right direction. We need a much stronger coordination mechanism.
The huge question now is what's going to happen in Africa, where facilities are weak. We've got the biggest problem at the moment, but many African countries reporting several cases. You've said before that the world is only as strong as its weakest health system. Do you believe we're about to experience how weak that is, in fact?
Well, Africa is our major preoccupation. Fortunately, yesterday in the G20, several countries, France, Germany, Russia and others, have said that there must be a priority of the international community addressing the needs of African countries. We have many UN operations in Africa, peacekeeping operations. South Africa participates in some of these peacekeeping operations. We have our country teams working with government, so we know well the extreme difficulties that many African countries have in their health systems to respond to this dramatic pandemic. And so a massive mobilization of international support to Africa is indeed a priority. We have problems also in Latin America that need to be addressed, in some areas in Asia that need to be addressed, but Africa is indeed the continent where more efforts must be concentrated. Because, and this is in the interest of the countries of the North, if we would leave the virus spreading like wildfire in the African continent, we would have millions of people infected, millions of people dying, and we would have so many transmissions that there would be easy ways for the virus to mutate. And with a mutated virus, even those countries in the north that in between might have developed vaccines, those vaccines would serve no purpose. And the disease would move north again. So it's in the interest of everybody, it's in the interest of the developed countries of the global north to support the African continent.
Yeah. You've said before that the consequences could be catastrophic, in fact. Do you see yourself right now as mainly an advocate for the needs of the developing world, for Africa specifically?
I think we have not yet enough conscience in the world in general. I think we need to have more voices and we need more pressure. And fortunately, I believe the International Monetary Fund and the World Bank and the African Development Bank are aware of these. And we have been in close contact, and they are also putting a lot of pressure to get the resources and the capacities that are needed. But of course, there is still a long way to go in order to be able to provide all it is required to fight the pandemic and to support the economies and the societies.
Mr. Secretary General, may I ask how you're feeling tonight? The World Health Organization is saying earlier that there are now more than 500,000 cases around the world, more than 20,000 deaths. This virus seemingly out of control, an unprecedented escalation every day, new cases. Does the situation seem hopeless, or do you have hope tonight?
It is not helpless. Some countries have proven that adopting the right policies, they can defeat the virus. Look at Singapore. Singapore managed to avoid the penetration. Had a huge impact because of a religious sect that had imported the virus and spread it all around the country with a very determined policy of testing, tracing, and quarantine. They were able to defeat the virus. But of course, that requires financial capacity, that requires medical capacity, and that requires obviously the levels of solidarity without which a continent like Africa cannot replicate what was done by Singapore or by Korea. And we see that even in Europe, countries like Italy or Spain are today struggling because they had not things prepared enough for the kind of pandemic that also came to those countries. So, as I said, Africa must be an absolute priority, and the world must do everything to avoid this pandemic to spread like wildfire in the African continent.
Yeah. On a personal note to close, how are you being impacted by this virus, if at all?
Well, I live in New York alone. My family is in Lisbon. I move from the residence to the office because I believe I am one of the essential staffs of the organization. The overwhelming majority of the staff is at home, but I'm working from home, but I come to the office because it's my duty. Obviously, I have the same feelings that so many have far away from their families, seeing the pandemic also entering into my country. So there is this concern, this anguish, but at the same time, a very firm determination. And I'm inspired by the courage of UN staff all over the world. We still have UN humanitarians, UN peacekeepers working in the most dangerous places, working in the most fragile situations in relation to the pandemic, and doing it with a lot of generosity. And that, of course, is the best inspiration I could have to go on doing the job here.
Well, thank you for your message of solidarity for South Africa as well tonight. That was UN Secretary General Antonio Guterres speaking to us live from New York.